Facial nerves. Small mistakes, big consequences. Sounds a little dramatic, right? But that's exactly what we're talking about today. We're diving into that super delicate network of nerves in our face and what happens when things, well, go just a tiny bit wrong.
And this really gets to the heart of it all. In aesthetic medicine, millimeters matter. I mean, that quote just perfectly nails the high-stakes world we're talking about. It's a field where even the tiniest little slip-up can have a huge, huge impact.
So that leads to the big question, right? What actually happens when an injection is just a few millimeters off? Well, to get that answer, we've got to understand this incredibly complex system that's working just under your skin. You know, the one that's responsible for every single smile, every frown, every little thing you feel on your face.
Okay, so to really get the risks, you have to think about the face's wiring. It's kind of like a house, right? You've got two totally separate electrical systems, and each one has a completely different job.
And this chap breaks it down for us. So, on one side, you have your motor nerves. Think of the facial nerve. This is all about action, all about movement. Then, on the other side, you've got the sensory nerves, like the trigeminal nerve. Their job is all about what you feel, touch, pain, temperature. So you see, two totally different functions, which means two totally different kinds of risks.
So let's zoom in on that first system, the facial nerve. This thing is the absolute master of expression. It is the action nerve. It's what lets you smile for a picture, raise an eyebrow when you're surprised, even just close your eyes. And it doesn't do all this work alone. It has 5 key branches, like 5 main wires spreading out to different parts of your face. Each one is in charge of a very specific zone of muscles. So now that we know the layout, let's see how this all translates into a map of, well, potential danger zones.
All right, so it's one thing to know where these wires are. It's another thing entirely to know where they're the most vulnerable. And that is where we get into the really practical, high-stakes geography of the face. And here they are. These are the hotspots: the temple, around the eyes, those smile lines, and the jawline. See, each one of these areas is where a major nerve branch runs really close to the surface. That makes them super vulnerable during an injection. Any good practitioner knows they have to tread very, very carefully here.
So you might be thinking, how does the damage actually happen? Is it just the needle hitting the nerve? Well, not always. It's actually a bit more complicated. Sure, a direct hit from the needle is one way, but you can also get an injury from the filler itself just pressing on the nerve. Or it can even mess with the blood flow that the nerve needs to stay healthy. 3 different ways for things to go wrong.
Okay, enough with the theory. Let's make this real. Because seeing the actual consequences, that's what really hits home, you know? So we're going to look at a few cautionary tales, straight from the clinic.
First up, the asymmetric smile. Think about it. The smile is probably our most important expression. It's so simple, so universal, but it relies on everything working perfectly. So here's what happened. Step 1, the mistake. An injection goes just a little too deep along the jawline. Step 2, the nerve that gets hit. It's called the marginal mandibular branch. And here's the result: a crooked, uneven smile. Why? Because that specific nerve controls the muscles that pull down the corners of your mouth. You damage that, and suddenly, one side of the smile just doesn't work right. It's really unsettling. All right, let's move on to our second case. We're going from the jawline up to the forehead and temple area, another really common spot for treatments.
This time, the mistake is filler that's just placed incorrectly in the temple. Seems small, right? But it ends up hitting the temporal branch of that facial nerve. And the result of that? A drooping brow. The patient literally can't raise their eyebrow on that side anymore. It creates this heavy, uneven look. It's called browptosis.
And for our last case, we're shifting gears a bit. This one isn't about movement. It's about sensation. It's a great reminder that it's not just the action nerves we have to worry about. Those sensory nerves are at risk too. So here's the scenario. An injection gets placed a little too close to this key spot right under the eye where a sensory nerve comes out. What happens is that nerve gets annoyed or compressed by the filler, and the outcome for the patient is this nagging, persistent numbness in their cheek. And we're not talking for a day or two. This can go on for weeks, sometimes even months.
Okay, so after seeing all the things that can go wrong, the big question is, how do the pros avoid this? How do they prevent disaster? Well, it all comes down to having a really clear, disciplined playbook. And this is it. This is the safety checklist. It's like a 4-step ritual. First, you have to review the anatomy. Everyone's a little different. Then you identify those risk zones we talked about. Next, you choose the perfect technique and the right depth. And finally, you inject slowly, and you are constantly watching, constantly monitoring. Every single one of these steps is there for one reason: to prevent the exact mistakes we just looked at.
And there's a really, really good reason for being so careful. Because when it comes to nerve damage, prevention is pretty much the only cure. Once that damage is done, the road to recovery is long, it's slow, and it's super uncertain. We're talking weeks, even months, with absolutely no guarantee that things will ever get back to normal.
And that really brings us to the final takeaway here. This powerful quote really says it all. Success is not just about beauty, it is about preserving function, safety, and trust. So in the end, the real goal isn't just to make someone look younger. True success, it's about something much deeper. It's about having a profound respect for the amazing, intricate anatomy that makes us who we are. It's about putting safety first, always, and it's about protecting that essential trust between a patient and their practitioner